Doctors tell you to exercise and eat well. Great advice. But do they practice what they preach? And how does sweating and cooking together when they're med students help them connect to the power of diet and exercise? We're learning from a couple of insider experts today on Across the Fence. Hello, Vermont. Healthy diet and consistent workouts are routinely recommended by doctors for preventing everything from cancer to anxiety and depression. So, if in med school, young docs have to learn about the drugs they prescribe, should they also learn about nutrition and exercise? When? And what's the most impactful format? UVM's Larner College of Medicine was tackling these questions even before the U.S. Department of Health and Human Services recently weighed in with a mandate for nutrition training during medical school. Joining me to talk about the types of experience-based nutrition and exercise training UVM med students receive are Dr. Whitney Calkins and Aiden Masters. Aiden is a third-year med student who's teaching a peer-to-peer class for first-year students on exercise as medicine, and Dr. Calkins is a family medicine physician at UVM Med Center and an assistant professor at the Larner College of Medicine who teaches and has helped design classes on culinary medicine. Aiden and Dr. Calkins, welcome. I'm very excited to have both of you on. We've had a great chat already. You know that this is something that I'm also very passionate about, so I think this is going to be a really great conversation. Dr. Calkins, we know that the relationship between, what do we know about the relationship between diet and exercise and health? Like, why is this something doctors are always recommending?
Well, let me just set the stage just a little bit with
You
that,
go right
okay?
ahead.
So, we know for certain that diet, especially healthy diet eating patterns that involve whole foods, vegetables and fruits, healthy protein choices, whole grains, that these eating patterns and exercise, especially if you can go that 150 minutes a week, that's your sweet spot, moderate intensity, that these all reduce your risk of developing chronic diseases, as well as they can start to remediate and reverse chronic disease. And that is something borne out in our guideline-based care. I do want to bring up a little local thing for Vermont, because so the Vermont Department of Health has a 3-4-50 initiative. I don't know if you've heard about this, but this is an initiative to help get our communities and our classrooms and our neighborhoods aware that diet, 3 behaviors, diet, exercise, and cigarette smoking are leading to 4 chronic diseases, which is heart disease and stroke, cancer, type 2 diabetes, and lung disease. And those 4 chronic conditions drive 50% of all the deaths of Vermonters.
Oh, wow.
So diet, exercise, and smoking.
Okay.
To put that really into Vermont,
Yes.
50% of all deaths.
Diet, exercise, and of course not smoking.
Right.
Yes.
Not smoking.
Yeah, 3-4-50. Well, that's fantastic. I mean, that's a really easy way to be able to think about how tied in these behaviors are to having better health outcomes. Aiden, talk to us a little bit about the course you're teaching.
Yeah, so similar to what Dr. Calkins was talking about, I teach the exercise as medicine. And in this course, it was started by Alex Jenkins, who was a 4th year when I was a 1st year, where I took the course and I loved it. So in my 2nd year, I became involved in the course and sort of helped to teach it. And then now as a 3rd year, I am organizing it and teaching it sort of by myself. And in this course, it's broken up into 4 different sessions. They're each 2 hours. In the first hour, we have a didactic session that is led by one of the UVM doctors.
Didactic meaning this is when it's like lecturing, teaching?
Yeah, it's like an educational session where a doctor comes in and speaks about something they're passionate. That could be either exercise physiology related or sort of like behavioral modification related, and how we view talking about exercise with patients. And then in the second half of the session, we learn about a type of movement, whether that's aerobic movement or strength training. And we have either a student or another local member of the community teach us and lead us through a movement session that we all work through together.
And I was asking questions about this earlier. So you're at gyms, you're sometimes at the Y, you're lots of different locations so that you can do both of these 2 pieces, because the workout's a big piece of it.
Yes,
yeah,
definitely.
And then talk a little bit more about that behavior modification, because that's something that I had when I was working in nutrition and food sciences. We would talk about preventing what we called pamphlet syndrome. The idea that you don't just hand somebody a pamphlet and say, eat healthy, that you actually want to think about the barriers between people enacting certain types of behaviors. So talk to us about behavior modification, because that's one of the goals.
Yeah, so It's
or
as
understanding it?
a learning physician, and I'm sure as Dr. Calkins can talk about as a physician, it's difficult to talk to people about exercise, and it's difficult to get people to change their behaviors. So actually several of our sessions, our didactic sessions, are related to like behavioral psychology and how do we talk to patients about exercise? How do we engage in motivational interviewing to help them develop an intrinsic motivation to make themselves better and exercise daily? How do we establish behavior loops and habit changes in our patients and get them to develop these behaviors that let themselves engage in these exercise activities on a healthy basis?
Yeah, because ultimately it's the individual that has to do the work.
Absolutely.
It's one thing to know what you should do. It's another thing to actually say, I'm going to build a routine, I'm going to stick to that routine, I'm going to enact these behaviors. That's really hard. Dr. Calkins, tell us a little bit about then the culinary medicine courses.
So the culinary medicine courses at UVM are, it's not straight culinary medicine, but it is food is medicine, nutrition, and some mix of culinary medicine. And one of them is an extracurricular called Cooking with a Curriculum. That is what I've had a grant for the last couple of years. But it's similar to that peer-led training that Aiden just described. We had first-year students who wanted to increase nutrition education. I wanted to do that as well. We connected. They and I and some other stakeholders, including dietitians, created 5 didactic education sessions with lecture, but we wanted it to be experiential because it's so much more fun and it sticks better. So we do an hour of introduction to nutrition, might be an example. Then they make something to eat. They'll make a soup, or they'll make some kind of, grain bowl with lots of vegetables, or we have a smoothie contest in one of the sessions. And the students love it. And then we evaluated it later, and they came back and said 90% said this is something, no, 99% said this, all students should have this sort of education. And then we've just recently interviewed third-year students who took it as first years, and they're using it in their education, or in their, not in their education, in their clinical practice. And they apply it to their own lives. And that's really important. We also are teaching communication around motivational interviewing to help people with behavioral change. And because, as Aiden mentioned, it's so important. You can't just talk to a patient or talk to a student and say, this is what you should do. You need to provide some structure and support for it. Well, and how do you do it?
I mean, if it was that easy, we all would be doing all of the things that we have been recommended to do.
We wouldn't have to worry about 3, 4, 50, right?
Yeah, exactly. Well, okay, so let's talk a tiny bit, because the Department of Health and Human Services recently did do some recommendations, and at the time they came out, many things have been controversial. This one sort of wasn't entirely viewed so, mostly because medical schools were already doing a lot of the things that had been advised. Do you think that the recommendations go far enough? Mostly they're looking at nutrition education, for example. They don't include exercise. What do you think?
Well, I have looked really closely at the nutritional competencies, and they're very broad-based. I mean, they're talking about foundational nutrition, about the communication piece, the psychology of healthy behaviors. It's also looking at social determinants of health and food insecurity, and just really even deeper, who needs to go beyond what a doctor can prescribe in an office and needs to work with someone, a specialist, like a registered dietitian. And we are doing a good job at Larner College of Medicine of meeting these competencies. And it started before UHHS, right? And it's been going on for decades in the nutrition medicine GI course, but we're recently adding more of the psychology and the food as medicine and the cooking with the curriculum. But we've been doing it.
Yep. Is there any argument against including exercise or nutrition courses as part of medical training?
I can't imagine an argument against it, given that almost every guideline from every society, from cardiologists to endocrinologists to family medicine, peds, psychiatry, cancer societies, all say first-line therapy for chronic disease management are diet and exercise, nutrition, good nutrition, and physical movement. They're so key.
Yeah. Is it difficult, though, to find space in the curriculum? You said that the exercises medicine class, it began 3 years ago or 4 years ago, because you took it as a first year and it was
Correct.
the first year.
Yep.
So, and you've been on a grant. So is it difficult to find space in the curriculum? Because obviously I'm thinking med students are taking a lot of classes. There is so much to learn. And of course, everything competes for time and cognitive cycles with everything else.
Well, you make a very good point, because it is difficult to squeeze everything into the curriculum. And we are trying to integrate as much as possible, bake it in, pun intended, to our curriculum at Larner College of Medicine. But yes, the medical students are already pretty overburdened with a lot of information. And so if we can put it in there, and students do have a willingness to do some of this after hours. Like, I don't know what time you go and do your exercise courses, but it might be 5 or 6 o'clock at night. And our Cooking with the Curriculum is at 5:30 to 7:30 at night. But the students are very willing to do that, to get the experiential part. And I think that faculty like myself, Dr. Pinckney, who's working in the exercise medicine, and others, we can all, I think we all have the heart and the little bit of time it might take to get in and do that didactic part and provide that structure.
And I know that you are big on working out, and I think that when we spoke, you talked too a little bit about how working out, for example, has helped you through your medical school. And we just have a minute, but tell us just a tiny bit about what it's like to use working out as a student.
Yeah, exercise has always been a really important part of my daily routine, and I think especially after a really long day at the hospital and helping take care of other people, I think it's really important to prioritize your own self and do something every day that contributes to your own physical and mental health. So it's been a really important part of my prevention of burnout and helping me cope with the stresses of my daily life.
Yep, something that cooking can do for people also, right? Absolutely, yeah.
Absolutely.
Thank you both so much for joining me, Dr. Calkins,
You're
Aiden.
welcome.
This has been
Pleasure to
great.
be here.
Good luck. I know you just finished your board
Thank you so
exam,
much.
so you've got quite a new journey coming up ahead of you.
Yep.
All right. And as always, thank you, Vermont, for learning and exploring with me today. And thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.